Hello and good morning to all. Today we will talk about the definition of homeopathy. As per Dr. W.E. Boyd, Dr. W.E. Boyd definition says homeopathy is a specialized system of therapeutics which assumes that deviation from fundamental means within reversible limits can be restored back to normal with the help of stimuli usually applied in the form of drugs, only subphysiological doses of which are necessary and whose action is always directed towards normal because of altered receptivity of tissues to stimuli in disease. Why we are talking about this definition? This is a complete definition which tells us about what is homeopathy, what is the kind of treatment we give to the patient, what is the scope of homeopathy, what are the limitations of homeopathy, and uh, and I think if you clearly understand this definition, you will never fail in your homeopathic practice. So, point by point, we'll take this definition. First point is that homeopathy is a specialized system of therapeutics. What is this therapeutics? Yeah, what is this specialized system of therapeutics? So, homeopathic speciality treatment is based on law of similia. That is similia similibus current, which means likes are cured by likes, or let likes be cured by likes. So you prescribe a medicine for which you have a proving, and a patient gives us the symptoms or the totality of symptoms, and you match this totality of symptoms of the patient with the proving symptoms and then prescribe a medicine accordingly. And what this medicine does, it restores the patient towards normal, and it cures also. Yes, you can cure the disease if your medicine is exactly suitable, or it's a homeopathic simillimum. You can cure the disease, cure the patient. Secondly, it says that homeopathy is a specialized system. Why? Because we treat the patient as a whole. We individualize the patient. We treat that particular individual who is having a disease. We are not treating the disease. We are treating the individual having the disease. And so we are more, in a way, suppose we can also say that we are increasing his, we are increasing his immunity. Yes, our medicines can increase the immunity, and they can prevent diseases also. Our medicines can can help him in his body defense, and the disease is treated. Or we can also say that, suppose you are having some joint pains and you go to a homeopathic prescriber. He takes your symptoms and he gives you some medicine and your pain goes. So was that a painkiller? No, that was not a painkiller. That was your individual medicine. If some other patient comes with same set of joint pains, same type of joint pains, the medicine may or may not be the same. If the medicine is same, the potency may be different. So this is what is meant by subphysiological doses. So subphysiological doses are the different potencies or the minuteness of the dose, law of minimum, which we have studied in the basic homeopathic lectures. So according to law of minimum, we have to give the medicine in that means a minimum quantity. For example, you add salt in your food. What is the quantity of that salt? Is that salt equal for all households or for the same type of vegetables you cook? Is your taste the same? Somebody needs extra salt, somebody needs less salt. So this is what is with homeopathy also. So our medicine may or may not be the same, and the quantity of the medicine may or may not be the same with same set of diseases, same set of symptoms. So this is what is individualization and subphysiological doses. And why these subphysiological doses of medicines are needed? Because when a patient is ill, when a patient is sick, or a person is sick, he is having some set of symptoms, some altered sensations and functions. So you might be having this experience. Whenever you are sick, you are not normal. You're you have a different craving for something at that time, which may not be at normal time. You may be having you may be feeling chilly during your phase of illness, while during normal phase you may not be that chilly, or you may be hot also. So your thermal reactions may vary, your likings may vary, your dislikings may vary, your mental state may vary. So all these things are taken into consideration while we take the totality of symptoms, while we make a totality of symptoms. And this totality makes we consider this totality as the characteristic totality, not the numerical totality. So we have to make a characteristic totality, and then we have to match those symptoms with the disease symptoms, or the disease symptoms with the drug symptoms, and then we have to prescribe a homeopathic similar remedy, simillimum, which we call. So the next point comes into consideration: what all diseases can a homeopathic doctor or a homeopathic prescriber treat? So this is the scope of homeopathy. The scope of homeopathy lies in the fact that wherever you get individualizing features, where you can individualize a person, those all diseases and those all or every disease you can treat where you have individualizing features, or where you can create some individualizing features. This is your quality, and this will come with experience. So the individualizing features, how you will get those symptoms, how will you gather or you will collect those symptoms. Dr. Boning Hassan has very beautifully told us 7 points: quis, quid, ubi, cure, cubus oxylus, quomodo, and quando. These 7 points tell us about those totality of symptoms, how we can gather it. So these points deal with the patient, the disease, the symptoms when they occur, the modalities, the aggravating or ameliorating factors or the modifying factors of the disease, how they started, the concomitants, and the cause of disease. Yes, so the cause of disease is very important when you start treating or when you start writing case history. Suppose a patient comes to you and tells us that he went out and suddenly there was a rain and he became wet. So after getting wet in rain, he has certain symptoms: coryza, sneezings, some body ache, and he's feeling a little chilly. So what medicine comes into your mind? Yes, Rustox comes into your mind, and this case is of recent origin. It is of acute. It is an acute case. So you will think of an higher potency. Suppose Rustox 200, and what is the dose? You can prescribe him. Since this is the acute case, you can prescribe him the medicine even 3 times a day or 4 times a day after 4 hours interval for 2 days, and the patient will be all right. If certain set of symptoms remain, you can again get back to the symptoms, collect what new symptoms are there, and if any old symptoms are still there, still patient is having those some old symptoms, you can prescribe a new remedy based on a collection of both old and new symptoms. So you have a scope in acute diseases, you have a scope in chronic diseases where patient is having those symptoms from so many years, and so many years means those symptoms are part of his life. He has thought that these symptoms are part of my life and they will never go, and a homeopathic prescriber can treat those symptoms as chronic ailments, and you will wonder, you will feel amazed when you treat such kind of patients and the patient says, "Doctor, I am all right now." Next scope is the diseases of children: delayed milestone, teething troubles, etc. Patient, the child is not thriving well, he's having digestive disorders, he's averse to milk, or milk disagrees, such kind of symptoms we can treat it very nicely. And then maternal health. During delivery, a female is having lot of vomitings, she is very weak, she is not feeling like eating anything, or her taste is different for different things. So we can prescribe medicines on those set of symptoms, and our medicines will not only help that female, but it will help the fetus to develop in a more healthier way, and a more healthy baby will be delivered. So this homeopathy can do, which no other pathy can do. So next scope is the mental diseases, patients having depression, suicidal thoughts, anger, patients who are afraid, having fear of darkness, fear of anything. So we can treat those kind of patients. So it has a scope in mental diseases also. Then it has a scope in all those diseases where allopathy does not have a scope. Allopathy treats the patient on diagnosis, but we can treat the patient even before a diagnosis is made. Why? Because we treat the patient on his symptoms, on his or her symptoms, not on the diagnosis. Suppose a patient comes to you with burning urination. So will you wait for the urine culture and examination to be done, or you will start the treatment immediately? You can prescribe the medicine on the symptoms, whether the patient is having that burning before urination, during the urination, after urination, or during the last few drops of urine. So we have a medicine for each one of them. So this is the scope of homeopathy. Then what are the limitations? Limitations are where we have a lack of individualizing symptoms. That means the patient has a pathology which is in advanced stage, and we have more of pathological symptoms rather than the general symptoms, or the mental and physical generals are lacking there. So we have, in such a case also, we can prescribe medicine. The patient may not be cured in such cases, but we can at least relieve the patient, we can enhance his quality of life, so that he can lead a normal life as much as possible with medicines. And what our medicines will do in such cases, our medicines will help him in the most painful set of symptoms. It will increase his quality of life. Suppose an old age patient who was not able to get up properly from a sitting position or a lying position will be able to get up with little help, or with not without a help at all, with our homeopathic treatment. This homeopathic medicines can do. So this is what definition of homeopathy tells us, and I hope you have liked this lecture, and hope to meet you soon. Thank you.